Greetings, health enthusiasts and curious minds. Welcome to Brainetainment, where we delve into the fascinating world of health and wellness. Our mission is to provide you with insights backed by science to help you live a healthier and happier life. We unravel complex health mysteries, debunk common myths, and explore innovative solutions to everyday health challenges. From mental health to physical fitness, we've got you covered. Today, we delve into the realm of migraines, a common yet often misunderstood condition. Migraines are not your ordinary headaches. They are a neurological condition characterized by intense, throbbing pain, often on one side of the head. To truly grasp what migraines are, we need to delve a little deeper into the realm of neuroscience. Migraines are essentially a result of abnormal brain activity. This activity can be triggered by a variety of factors, such as stress, certain foods, or even changes in the weather. Unlike your typical headache, migraines come with a host of other symptoms. These can include sensitivity to light and sound, nausea, vomiting, and a visual phenomenon known as aura. Aura is a series of sensory disturbances that often precede the headache, manifesting as seeing flashing lights, zigzagging lines, or losing vision temporarily. So, how do migraines differ from regular headaches? Well, the intensity and duration of the pain is a key factor. While an ordinary headache can be a nuisance, the pain level it causes is generally mild and short-lived. Migraines, on the other hand, can cause severe pain that lasts for hours or even days. Another distinction lies in the location of the pain. Regular headaches often result in a dull ache all over the head, whereas migraines typically cause an intense throbbing or pulsing sensation on one side of the head. It's also important to note that migraines can be debilitating. They can significantly impact daily life, making routine tasks difficult to perform. In fact, the World Health Organization ranks migraines as one of the top 20 most disabling illnesses. Interestingly, migraines also have a genetic component. If your family has a history of migraines, you're more likely to experience them. This doesn't mean you'll definitely get migraines if your parents had them, but the odds are higher. Finally, migraines are not gender neutral. Women are 3 times more likely to suffer from migraines than men. This is believed to be due to hormonal fluctuations, particularly during menstruation, pregnancy, and menopause. Now that we have a basic understanding of migraines, let's move on to discuss how to cope with them. Coping with migraines can be challenging, but it is not impossible. There are several strategies to manage the pain and reduce the frequency of attacks. Firstly, let's talk about stress management. Stress is a common trigger for migraines, so learning to manage stress can be an effective way to reduce the frequency of attacks. Consider techniques like deep breathing, meditation, and yoga. These practices not only help to reduce stress levels, but also promote a sense of calm and well-being. Regular exercise is another key strategy. It may seem counterintuitive, especially when you're in the throes of a migraine, but regular physical activity can help to reduce the frequency and intensity of migraines. Exercise releases endorphins, the body's natural painkillers, and promotes better sleep, which is another important factor in managing migraines. Speaking of sleep, getting adequate rest is crucial. Both too much and too little sleep can trigger migraines, so strive for a balanced sleep schedule. Aim to go to bed and wake up at the same time each day, even on the weekends. Create a restful sleep environment by keeping your room dark, quiet, and cool, and avoid screens before bed. Dietary changes can also play a role in managing migraines. Certain foods and drinks, such as aged cheese, alcohol, and caffeine, can trigger migraines in some people. It can be helpful to keep a food diary to identify any potential triggers. Eating regular balanced meals can also help to prevent migraines. Hydration is also important. Dehydration is a common migraine trigger, so be sure to drink plenty of water each day. In addition to these strategies, relaxation techniques such as massage and acupuncture can be beneficial. They help to relieve muscle tension, which can contribute to migraines. Remember, everyone is different, and what works for one person may not work for another. It may take some trial and error to find what works best for you. While these coping strategies can be helpful, there are also medical treatments available for migraines. Medical treatments for migraines can be divided into 2 categories: preventive treatments and pain-relieving treatments. Let's delve into these categories. Preventive treatments aim to reduce the frequency and severity of migraines. They include medications such as beta blockers, antidepressants, and anti-seizure drugs. These are usually prescribed for those who experience frequent or severe migraines. It's important to note that the effects of these drugs may not be seen instantly. They're typically taken daily, and it may take several weeks to see a noticeable difference. Pain-relieving treatments, on the other hand, are taken at the onset of a migraine to alleviate symptoms. These include over-the-counter drugs like ibuprofen or aspirin, as well as prescription drugs such as triptans or ergots. Triptans are often the go-to prescription drug for severe migraines, as they can help to reduce symptoms like pain, nausea, and light sensitivity. Ergots are generally used for migraines that last longer than 48 hours. There are also alternative therapies available for those who prefer a more natural approach. Acupuncture, for instance, has been found to be beneficial in preventing migraines. Biofeedback, a technique where you learn to control physiological processes such as heart rate and muscle tension, has also shown promise in reducing the frequency and intensity of migraines. It's worth mentioning that all these treatments have potential side effects, and their effectiveness varies from person to person. So it's crucial to work closely with your healthcare provider to find a treatment plan that suits you best. Even though we've focused on medical treatments, let's not forget the non-medical approaches. Simple lifestyle changes can significantly impact migraine management. Regular exercise, a consistent sleep schedule, and a balanced diet can all contribute to fewer migraines and less severe symptoms when they do occur. While medical treatments can provide relief, lifestyle changes can also play a crucial role in managing migraines. So explore, experiment, and find what works best for you in your journey towards a migraine-free life. Lifestyle changes can significantly impact the frequency and severity of migraines. These changes often involve diet, sleep, and stress management. Let's delve a bit deeper into these areas. Firstly, sleep. Maintaining a regular sleep schedule is vital. Our bodies love routine, and this couldn't be truer for our sleep patterns. Aim for 7 to 9 hours of uninterrupted sleep each night. Too much or too little sleep can trigger migraines, so find your sleep sweet spot and stick to it. Next, we talk about diet. You might find that certain foods or drinks trigger your migraines. Common culprits include aged cheese, processed meats, and alcohol, particularly red wine. It's a good idea to keep a food diary to identify any potential triggers. Also, try to eat regular meals. Skipping meals or fasting can trigger migraines in some people. Now let's discuss caffeine. While a small amount can help relieve a migraine in the early stages, too much can lead to a caffeine withdrawal headache. If you're a heavy caffeine user, consider reducing your intake gradually. Going cold turkey can lead to withdrawal symptoms, including, you guessed it, migraines. Last but not least, stress management. Stress is a common trigger for migraines. Try incorporating relaxation techniques into your daily routine. This could be deep breathing exercises, yoga, or mindfulness meditation. Regular physical activity can also help reduce stress levels. Aim for at least 30 minutes of moderate exercise most days of the week. Remember, everyone's migraine triggers are different. What works for one person may not work for another. It's all about finding what works for you and sticking to it. It may take some time and a bit of trial and error, but the benefits can be significant. Making these lifestyle changes can be a powerful tool in your arsenal against migraines. Be patient with yourself. It's a journey, not a race. But with time and persistence, you can reduce the frequency and severity of your migraines, improving your overall quality of life. Migraines can be a debilitating condition, but with the right approach, it is possible to manage the pain and reduce the frequency of attacks. So what have we learned today? Firstly, understanding migraines is key. They're not just a regular headache, but a neurological condition that can lead to severe throbbing pain or a pulsing sensation, often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Secondly, coping with migraines involves both physical and psychological strategies. These might include finding a quiet, dark place to rest, using a cold compress, and practicing relaxation techniques. Maintaining a positive mindset is also vital, as stress and anxiety can often trigger migraines. Thirdly, we've explored the effective treatments available for migraines. These range from over-the-counter pain relievers to prescription medications designed to reduce the severity and frequency of migraines. We also highlighted the importance of seeking professional advice before starting any treatment regime. Lastly, we delved into the lifestyle changes that can help manage migraines. Regular exercise, a balanced diet, and a consistent sleep schedule are all crucial. Avoiding known triggers such as certain foods, alcohol, and excessive caffeine can also make a significant difference. Thank you for joining us today on Brainetainment. Remember, knowledge is power. Keep exploring, keep learning, and most importantly, take care of your health. Don't forget to subscribe for more enlightening content. Until next time.